Hi everybody, my name is Hakkı Dalc. I'm a professor in anatomy department, and this is our next video. And today's video will be dealing with the heart anatomy. So first I'm gonna go over the heart on the models, and after that we'll go over the heart anatomy on the cadaver. Okay, so I'm ready. If you're ready, we can get started. Okay. Okay, the heart is basically located in the mediastinum, and specifically speaking, it's located in the middle mediastinum. What we see here is the thorax, and these are the costa, and this is the costochondral joint, this is the costal cartilage, and we have the sternum in the middle. On either side, we have the ribs. So basically, the heart is located behind the sternum, in between the second and the fifth rib, about somewhere around here. Okay, that's the level anteriorly. And in terms of its borders here, so we have the third on the right side, at the borders of the right side of the heart is at the third costal cartilage, and it goes all the way to the sixth costal cartilage, just behind on the right side, the border of the sternum. However, on the left side, since the heart is tilted a little bit, it moves up a little bit further up above to the second costal cartilage, or intercostal cartilage, intercostal space, second and all the way to the fifth. So we have the 3-6 and 2-5. So the heart is slightly tilted up towards the left. So the left part of the heart stays beneath and inferiorly to the right side of the heart is tilted inferiorly compared to the left side. So we have 3-6, and on the left side we have it's located in the second costal cartilage, second intercostal space, and the left inferiorly at the fifth intercostal space. Okay, and so that's the reflections, projections of the heart, medial and lateral. And if you look at the heart is primarily towards the left side. So if you draw a line at the middle of the sternum, 1/3 of the heart is located on the right. However, 2/3 occupies more at the left part of the mediastinum, middle mediastinum. And by looking at the thorax wall in physical examination, one of the important aspects is the auscultation sites, as you know. So there's 4 auscultation sites where we hear the sound using the stethoscope. So in the class, remember I mentioned 2, 2, 4, 5. 2, 2, 4, 5 means the intercostal spaces. So this is the first costa, second costa. Second intercostal space is beneath the second costa. So this is the second intercostal space on the right, and this is the second intercostal space on the left. So we have 2, 2, and then we have 4, 5, 2, 2, 3, 4. Okay, so 2, 2, 4 intercostal space on the left, and then we have the fifth intercostal space on the left again. So the only auscultation site that we see on the right is this one here, the first one. Okay. So the first, second on the right side, intercostal space. When you put your stethoscope over here, the sound that you will hear is the aortic valve sound. Okay. So these sounds are important to investigate in a physical examination in order to predict a certain disease that might occur, or that you might come in contact with, like stenosis or regurgitation implications. And in the so normal sounds is the lub-dub sounds, and these basically are the sounds of the closure of the valve. So when the valve closes, it creates these sounds, and what we call these sounds as the lub-dub sounds. Okay, so lub sounds primarily is from the tricuspid valve and the atrioventricular valves, which is the on the right side is the tricuspid valve, on the left side is the mitral or bicuspid valve. So these are the lobes. The dub sound, the second sound, comes from the semilunar valves, the aortic and pulmonary valves. So these are the sounds that we normally hear using a stethoscope, and the sites that you hear these sounds would be so forth. Is, like I said, 2, 2, 4, 5. So the first on the right side, the second intercostal space on the right side, just medial, just very close, the border on the right side, the border of the sternum. The second intercostal, so this is the aortic valve or aortic semilunar valve sound. And across that, on the left side, the left second intercostal space, if you put a stethoscope here, the sound that you would hear would be the pulmonary valve, the pulmonary semilunar valve sound, okay? So these are the 2 2s, okay? And then we have, so the only sound that you would see on the right is the aortic. The rest of the sounds, or the auscultation sites, would be on the left side of the sternum. So this is second, third, then the next is the fourth intercostal space. Again, fourth intercostal space is the tricuspid valve sound, and the fifth on the left side, fifth intercostal space would be the mitral valve sound. Will be the bicuspid or mitral valve sound. Now, the mitral, it's like the mitral, the exact place of this, the fifth intercostal space would be right about, this is the midline of the sternum, so it's like 8 and 10 centimeters away from the midline, okay? Away from the midline. If you put a dot here, and vertically, if you draw an imaginary line, that passes through the mid part of the clavicle. So this is the midclavicular line. So the midclavicular line and 8 and 10 centimeters that crosses the midclavicular line. At that particular spot, it would be the left intercostal space where you would hear the mitral sound. This is the auscultation site or position or the area for the mitral sound. Actually, just remember that these sounds are, these particular spots are not the places, positions, or the particular regions where the valves are located, okay? So the sounds are heard in a far distance from the valve, and so the sounds are particularly heard by the direction of the blood flow. Okay, so when we say 2, 2, 4, 5, those are the areas where we see the sounds, but the blood flow is basically going in that particular direction. However, the position of the valves is a little bit different. I'm not going to go into that. So basically, for example, the aortic valve sound is heard in the right second intercostal space. However, the valve is located at the third at the level of the third costal cartilage. So it's located somewhere around here, just behind the sternum, towards the right. So the valve is located somewhere around here, but the sound is heard above at the level of the second intercostal. The valve is located at the third costal cartilage. So basically, so the aortic, so the blood is going in this direction, upwards. Okay, and similar. It goes with the pulmonary. So the valve is located somewhere around here at the third intercostal space, and the blood is going upwards, and you hear the sound at the second, and so goes with the tricuspid and mitral, and so the blood goes in upward direction in the aortic and pulmonary valve closure. However, in the tricuspid and mitral valve, they go down. So at the mitral valve sound is basically located. The valve is located at the fourth on the right, but the sound is heard at the left fourth intercostal space. So it goes in this direction. So it goes with the mitral valve. That the valve is located somewhere around on the left side, on the border of the sternum, at the fourth intercostal space, and that the blood flow goes in this direction, down, okay, and therefore you would hear this auscultation sound of the mitral valve on the left fifth intercostal space. So my point, so the best thing to get to capture from all this, what we say is, if you just remember the auscultation size 2, 2, 4, 5, okay, that's enough, and just remember that these sounds are heard at the area where you would see the direction of the blood flow, rather than the position of the valve. Okay, so that's that. So basically, so it's behind the sternum, like I said, between the second and fifth costal cartilages here, and so much majority of the heart is located, primarily 2/3 of the heart is located on the left side, and so if I get this out. Okay, the rest of this, I'm just gonna just show you that the heart here is located in the middle mediastinum. So we have, so this is the thoracic cavity, okay, and in thorax, so in the mid part of the thorax we have the mediastinum. So we have the anterior mediastinum, which is located in between the pericardium and the sternum, or the heart of the sternum. To be more precise, it's pericardium and sternum. That's the anterior mediastinum. Middle mediastinum is where the heart is located, and where the great vessels emerge from the heart. So this area, what we look at, is the middle mediastinum. Here is the posterior mediastinum, where the descending aorta, where we see the esophagus, we see the trachea bifurcation, and we see the neurovascular supply, like the hemiazygos and azygos and thoracic duct, and the nerves and sympathetic tract. So this is the posterior mediastinum. So what we're looking at, the heart is located in the middle mediastinum. And as you can see, the heart is basically sits on the diaphragm. So this bulging out, that looks like an umbrella. Okay, so this is the diaphragm. And just recognize the diaphragm at the mid part of the diaphragm. So on either side of the diaphragm, we say, so we have the hemidiaphragm. So this is like left hemidiaphragm, right hemidiaphragm. And at the middle, it's whitish. The reason why it's white color is this is tendon. So basically the heart, as you can see, it sits on this whitish area, which is tendon, and this is called the central tendon of the diaphragm. So we're going to look at the surface, which part of the heart sits on the central tendon of the diaphragm a bit later. So this white area at the middle is the central tendon of the diaphragm, and basically the inferior shaped organ. And it's around about 300 grams in males and 250 in females. And this is the height here, okay, from here to here, where the major vessels emerge here. It's like 12 to 13 centimeters, and width is like 9 and 10.5 centimeters in width. And like I said, it's a cone shaped, but the so we're gonna look at the surface and borders a bit later. And so basically, so this part is the right part of the heart, which we can also refer to as right heart, and this part is the left part of the heart, or left heart. Okay, and so basically it's formed by 4 chambers. So if I take this out for a minute, okay, we can see the 4 chambers much better over here. So we have 4 chambers. We have the right atrium, right ventricle, left atrium, and left ventricle. And so this part of the heart is the right heart, and this part here is the left heart. And basically the atrium receives blood, okay, and the ventricles discharge the blood. Okay, so these are the major terminology or definitions of the chambers of the heart. So the atrium receives, and the ventricles discharge the heart. And if you look at the right heart is primarily involves the venous blood. Okay, so they contain venous blood, and the left part of the heart, which is the left ventricle, left atrium, and this basically is dealing with the clean blood, or what we call as the arterial blood, which contains high oxygen. Okay, so the venous blood contains low oxygen, okay, and waste material. The left heart is involved in carrying low oxygen, deoxygenated blood, or venous blood. So the left part of the heart is involved in carrying the clean blood, the arterial blood, or high oxygenated blood. Okay. So that's that. And so, like I said, it's a cone-shaped organ. As you can see, it's a cone-shaped, and it's right about at the measurement of position of your fist. Okay, so this is my heart and in my mediastinum, and so the exact position of the heart inside the thorax, or inside the mediastinum, is like so. So this part of the heart, the protrusion out, the sticky end at the distal end is the apex of the heart. Okay, apex of the heart, or apicus cordis, and the back part, the posterior part, is the base. So let's say this is the apex, and the posterior part is the base. So how is it positioned inside the thorax, inside the mediastinum? Is that the apex of the heart, the apicus cordis, basically faces down, left, and anterior. Okay. At the same time, we also move the base too. The base faces right towards right, and up. I'm sorry. The base faces outwards to the right and posterior. So basically, apex of the base becomes at the same position. So let's do it again. So the apex of the heart faces down, left, and anterior. Okay. So, and also you can basically remember this as that the apex faces towards left hip, and at the same time the base faces towards the right shoulder. And this is how it sits. Okay, so it sits like this. So this is how it sits. Okay, it sits on the central tendinium, or central tendon of the diaphragm. So this is how you would see your heart, not like this. You would see it like this. Okay, slightly directed towards left, like I said. The apex down, left, anterior, base upwards, face upwards, right, and posterior. So the base of the heart, you would see it will be directed posteriorly, and the apex anterior and towards left. Okay, so this is the exact placements of the heart inside the thorax. So what we see here, again, so this is the big heart, and let me show you on this. So these are the big blood vessels that emerge from the heart. Okay. So as you can see, we have the pulmonary trunk here. Pulmonary trunk divides into right and left pulmonary arteries, okay, at the front. And now, one difference thing is that the pulmonary arteries, although it's referred to as arteries, it contains the venous blood. So the right heart contains the venous blood, correct? Yes. Therefore, it carries the venous blood. However, so this is an exception. Normally the arteries. Okay, so normally the arteries carry oxygenated blood, clean blood. However, this is an exception of the heart, that the pulmonary arteries carries the deoxygenated blood, or increased carbon dioxide. So this is venous blood, although it's referred to as the artery. So we have the pulmonary arteries. Pulmonary arteries go to the lungs, and they come back from the lungs, getting oxygen from the lungs, and then they return as the pulmonary veins. Okay, so these are the pulmonary veins. They contain high oxygen. So this is clean blood, and they enter to the left atrium, to the left ventricle. And from the left ventricle, we have this ascending aorta, arch of the aorta, and then and then we have the descending aorta, and then basically it's distributed throughout the body. And coming out from the arch of the aorta, we have the brachiocephalic artery. Brachiocephalic is also referred to as the innominate artery. Brachiocephalic, as the name implies, brachio, so it then divides into subclavian and common carotid. Brachio, subclavian goes to the upper limb, and cephalic means the head and neck. So we have the common carotid artery, then divides to external and internal carotids on the right side. Okay, and internal, external carotid basically goes to the head and neck. Internal carotid goes to the head, supplies the brain. External carotid supplies the facial area, neck and face. And on the left side, we have, again, left common carotid, which is this. And it divides into external, internal carotid. Internal goes to the brain, external goes to the head and neck. And then we have the subclavian. Subclavian curves around and goes to the upper lip. This is the left subclavian and left common carotid. So that's that. Okay, so next, so this is like I said, in the heart we have, so the covering, we have the covering of the heart. The covering of the heart is called the pericardium, and partially we might stick a pin on this. Okay, so this is the pericardium. Okay, here, this white area that covers. So pericardium, I'm going to show you this in pericardium in the cadaver. It's more apparent there. But this is the pericardium. As you can see, it also covers the roots of the great vessels. This is the pulmonary trunk, and this is the ascending aorta. We can also see the vena cava superior vena cava over here. So it also covers the root, the initial part of the great vessels, the pericardium, and it covers the heart completely. At the back, as you can see, as the heart folds during embryonic development, in certain areas you have empty spaces, hollow, empty, big spaces, and these spaces basically are referred to as sinuses. And these sinuses are located inside the pericardial cavity. Pericardial cavity. So what is pericardial cavity? Basically, the pericardium is divided into two layers. It's the fibrous pericardium and serous pericardium. So we have two layers. Okay, fibrous pericardium is tough, it's strong, and it's superficially located. Okay, it's composed of dense connective tissue and increasing amount of collagen fibers. The second layer is serous pericardium. We have two layers of serous pericardium. We have the parietal layer and visceral. Parietal layer is attached to the visceral pericardium. Okay, the visceral layer is the one that is attached to the heart muscle or the heart tissue itself. In between the parietal and visceral layer, there's a gap, there's a space there, and that space is called the pericardial cavity, where you have the pericardial fluid in that area. So if you, so basically when you cut the fibrous pericardium along with the parietal layer of serous pericardium, you go in the pericardial cavity, which is this area here. So this is the pericardial cavity, and this area basically is what we, this area is, yeah, that's the pericardial cavity here. And I'm going to, so there's two sinuses, transverse pericardial sinus and the oblique sinus. Transverse pericardial sinus, I'm going to show you that in the cadaver. But just to look at it, it's basically, it's located somewhere around here. Okay, so it's located somewhere around here. It's behind the ascending aorta. Yeah, it's located somewhere around here. Okay, it's not really apparent, but so it's behind the pulmonary trunk and ascending aorta, and in front of superior vena cava. Okay, I'm going to show you this in the cadaver. So it's behind these two, but in front of superior vena cava. So if I put this through this area, you would see that it basically traverses this area. You can stick your finger and it will pass that. So that's the transverse pericardial sinus. The oblique sinus is located at the back here. Okay, you go at the diaphragmatic surface here, and you go all the way to, at the back, all the way to, at the base of the heart, where you see the pulmonary veins. So basically, it's located something, it's a J-shaped. It's between the pulmonary veins and inferior vena cava. So in this area, There's also a sinus, again, like I said, in a hollow space in the pericardial cavity and located between the pulmonary veins and inferior vena cava, and you go to that particular position from the back side. That's the oblique pericardial sinus. Like I said, I'm going to show you that in the cadaver. It's much better seen over there. Okay, so that's the pericardium. And again, in the pericardium, okay, I'll show the clinical, I'll talk about the clinical stuff over there. Okay, before going into the internal structures of the heart, let's look at the external features and externally, what areas do we see? Okay, so first of all, we have the apex. Okay, so this sticking out part of the inferior part of the heart is called the apex, apices cordis. Okay, and okay, so this is the apex, and okay, so as you can see, the apex belongs to the left ventricle. Now, the important things of the apex is that this is the most mobile, contractile and mobile part of the heart. Okay, this might be a question, and this is part of the left ventricle, by the way. Okay, and again, so the apex of the heart is it is located on the left, just like the auscultation site of the mitral valve. It's basically the same point. So normally we say that the left fifth intercostal space, 8-10 centimeters away from the sternum, away from the midline of the sternum and mid-clavicular line. So that specific area, right? If you put your stethoscope there, you would hear the mitral valve sound. However, if you put your fingers at that particular point, you can also might feel the contraction of the apex of the heart. Okay, so why? Because it's the most mobile part of the heart. That's apex. Right to it, just right to it, we have a notch or incisura apices. Okay, incisura, a notch of the apex or incisura apices. That notch basically. Just to the right, that notch basically it connects. So there's two. Okay, so I'm going to talk about the sulcus or grooves. We have two. We have the anterior interventricular sulcus and we have the posterior interventricular. So this notch basically connects these two sulci together. So this is the apex. Okay, and then we have the base at the back. So the base is located on the posterior aspect of the heart, which is this area here, as you can see. So when we say the base is primarily formed by the left atrium. As you can see, it's a quadrangular shaped. And so the base is primarily formed by left atrium and very small amount of right atrium. Okay, but the majority of the base is formed by the left atrium. And just behind the left atrium, okay, behind left atrium, you would have esophagus passing by the left atrium. Okay, this is clinically important. Why? Because if you have gastroesophageal reflux of acid coming back to the esophagus, it would affect the left atrium. It might affect the left atrium. Well, if you have dilation, some kind of tissue mass, it might affect the left atrium. But besides that, due to this acid reflux, you have a chest pain. Okay, so this chest pain, you might feel that chest pain in your chest, and you might mix that up with a pain that may be coming from your heart. So this chest pain is coming from two sources. It might come from the heart, or it might come from the stomach due to the acid reflux. So if you get an anti-acid, if it relieves, good. That's not your heart then. That's your stomach. So, but just remember that chest pain comes from two sources: cardiac source and the stomach course, or the acid. Okay, so that's the close anatomical relationship of the left atrium with the esophagus. Or if it comes from the heart, as you know, that chest pain might be due to MI, myocardial infarction. And myocardial infarction, besides this chest pain, you would have pain, or like shortness of breath, like increased amount of, sweating and fatigue, and you would have pain beside the chest. You would have the pain in the medial part of the arm, shoulder, neck, and slightly at the back. Too, you would have pain. So these symptoms would indicate an MI symptoms. But if you if you have an antacid, if it relieves, then that is definitely a reflux activity. Okay, so this is the base. Okay, what else do we have? We have this right pulmonary surface, left pulmonary surface. Okay, as you can. Okay. Anyhow, I'm gonna go. So in the right pulmonary surface, we have the right lung here, and the left pulmonary surface, we have the left lung. Okay. What else do we have? We have other surfaces that we have? We have the sternocostal surface, the anterior surface. This is the sternocostal surface. Okay. And then we have here the diaphragmatic surface at the back here, diaphragmatic surface. In the sternocostal surface, what do we have here? What do we see? Basically, we see primarily we see the right ventricle, as you can see, and right atrium. You see, and this is how you see this in chest X-rays. So while looking at it in a PA image, at the front of the view that you see, primarily it's formed by the right ventricle. Okay, like 2/3 of the image is basically composed of the right atrium, and 1/3 is composed of the left ventricle. And then we have the right atrium too. So 2/3 is formed by the right ventricle and right atrium, and 1/3 is formed by the left ventricle. Okay, so in the sternocostal surface, what else do we find? We have the anterior interventricular sulcus, along with the LAD and vena symphony magna, or vena cardiaca magna, or the great cardiac vein. So this is the sternocostal surface. And how about the diaphragmatic surface? The diaphragmatic surface is a surface that sits on the central tendon of the diaphragm, and that's this surface here. And the majority of the diaphragmatic surface is formed by the left ventricle, which is this part here. So 2/3 of the diaphragmatic surface is formed by the left ventricle, and 1/3 is formed by the right ventricle. So this is the diaphragmatic surface. What else do we have? We have margins. We have the right margin, margo-dexter, and then we have the left margin. This is the left margin, right margin, border, right border, left border, inferior border, and then we have superior border. Okay, the right border, which is this border here, or margo-dexter, which is basically formed by the right ventricle. It's vertical, as you can see here. The left, this is the left border here, and this left border is primarily formed by the left ventricle here, and it's kind of round, as you can see. It's kind of round, and it's also referred to as margo obtusus, or the obtuse margin. Obtuse margin. Okay, and here is the inferior. Inferior border is primarily formed by the right ventricle. So the left border is formed by the left ventricle, right border is formed by the right ventricle, and this right ventricle is slightly sharp, and it's also called acute border, acute margin, or margo acutus. And this is the superior border, as you can see. Superior border is formed by these great vessels that comes out, and the auricles, right auricle and left auricle. Auricle, again, like I said, it refers to as means ear. Appendix, it's also called appendix or appendages, right? Appendix, left appendix, right auricle, left auricle. Okay, so this is the sternocostal surface, diaphragmatic surface, apex, the base at the back, right margin, left margin, inferior margin, and superior margin or border or margo. Okay, so that's about it. Okay. All right, so this is the external features. Now let's go in and examine the internal features of the heart. Okay, let me show you the chambers with on this model here. Okay, so this is the right atrium. As you can see, we have this protrusion sticking out, projection of the right atrium outside, and this is called the auricle. As you can see, this is the auricle, and inside the auricle or atrial appendix. Okay, and inside this the auricular part, we have these trabeculated muscles. Okay, trabeculated muscles, and therefore the okay. So the right atrium, we have the smooth part and the rough part. This rough part is trabeculated part, and it's formed by a muscle called the pectinate muscle, or musculus pectinati. Okay, so this is the trabeculated part, the pectinate muscle, and this area, the rest of the area, is the smooth part. Okay, the smooth part is basically derived from sinus venarum. It is referred to as sinus venarum cavarum, and it's derived from sinus venosus, the right horn of the sinus venosus. And the rough part is also referred to as the atrium proper, okay, and that is derived from the primitive atrium. Okay, and the important things about this is that the rough part and the smooth part, where they unite, okay, and basically it's located between the opening of the superior vena cava and the inferior vena cava. Superior vena cava, inferior vena cava, the opening. So somewhere around here, where you would see the demarcation or limit between the rough part and the smooth part. And this part here is called the crista terminalis, so terminal crest. Okay, so the terminal crest is basically the elevation, the internal elevation of the right atrium inside, and we have the sulcus terminalis, which is an indentation located on the outside, externally. So we're not really dealing with the sulcus terminalis, it's not really apparent, but what we see is primarily the crista terminalis, which it is apparent, it's a small elevation, and inside this crista terminalis is the SA node, sinoatrial node, and this colored area here, that is referred to as the sinoatrial node, and the SA node is also referred to as the pacemaker, and the cells that are located here is called the P cells, which initiates the action potentials for the heart. Okay, so this is the crista terminalis. What else do we see here? We also see at the interatrial septum, this white area here, this white colored area. So this is basically the interatrial septum, and this is the white area is called the fossa ovalis, or fossa ovale. And this fossa ovalis is basically the remnant of foramen ovalis. So foramen ovale is basically formed by two septum, like this. Okay, so this is septum prim. Okay. Yes, like this. Okay, so here is the left atrium, here is the right atrium, and this is how it is. On the left side, this is the left side. Okay, this is septum primum, and this is septum secundum. So what happens is basically, so you have the blood in the right atrium passing from right to left. It pushes septum primum, you see? It pushes septum primum and goes to the left. Okay. Why? Because you don't want the blood to go to the right atrium. Why? The right atrium is in contact with the lungs via the pulmonary tract. So it passes the right atrium, and then therefore it passes the lungs, and it goes to the left atrium through pushing this septum primum. So this is the valve. So the opening here is foramen ovale. Okay, the opening is foramen ovale, and this acts like a valve, and this is called the valve of foramen ovale, and this valve is basically the septum primum. However, after birth, when the lung starts to work, so the blood comes to the left atrium, and you have an increased amount of pressure on the left atrium, and it pushes septum primum on septum secundum, and it closes the foramen ovale. Okay, it closes the foramen ovale. So you end up having this fossa here, just beneath the septum secundum. So this area here becomes a fossa, and that fossa is called the fossa ovalis. And the ridge that is formed by by the extension of the septum secundum is called the limbus. So the outer part of the fossa ovalis, primarily the superior and lateral, not inferior, but primarily the superior and lateral part of the fossa ovalis, you have this ridge, okay, or elevation of tissue which is formed by septum secundum. That forms the limbus fossa ovalis, or fossa ovale, limbus fossa ovale. Okay. But sometimes this it stays open. That is called the patent foramen ovale. It stays open, it doesn't really close. So the blood goes to the right atrium in adults. We're talking about adults, and to the right ventricle, and you end up having what we call as the right heart failure. Why? Because the blood, excessive amount of blood goes to the right part of the heart, either to the right atrium, right ventricle, and you have excessive amount of blood here, so you have the hypertrophy of right ventricle, okay? Because it works more to pump the blood to the lungs, and the blood that comes from the superior inferior vena cava, since there's a lot of blood here, it backs up. It backs up either to the head and neck, or it backs up to the abdomen, producing what we call as ascites. It also backs up to the low extremity in the legs and foot, and it would produce what we call as edema. So that's fossa ovalis. And what else do we see here? This part here, this is the valve of inferior vena cava here. Okay, I don't know if you can see it. This valve, basically, it's a rudimentary valve. Early in embryo, this was working. Why? Because increased amount of blood pressure would go through the inferior vena cava, and this valve basically acts like, preventing blood to go backwards. But after birth, this doesn't really work, so it's a rudimentary valve. What else do we see here? Next, this opening here is the ostium for sinus coronarius, or coronary sinus. I don't know if you can see it. Okay, here. And next to ostium sinus coronarius, this colored area is the area where the AV node is located. So that's the AV node. And this triangle, so we have this AV node. Where's the AV node located? AV node is located beneath the intra-arterial septum. Okay, beneath the intra-arterial septum, left to the coronary sinus opening, or ostium for coronary sinus, left to that, and above the right atrioventricular orifice. Above the right atrioventricular orifice, left to the coronary sinus, and below of the intra-atrial septum. So this area, it would have a... Okay, let's look at the same or similar things in this model here. Okay, so the AV node here is around somewhere around here, and this area is beneath the intra-atrial septum, left to the sinus coronarius opening, or opening of the sinus coronarius ostium, and above the right atrioventricular valve. So this is the right intra-atrial valve, or orifice, or ostium, above that. So it's around about somewhere around here. That's where the AV node is basically placed or located. So AV node, after that, it gives off, as you can see, it gives off a bundle, what we call as the AV bundle, or bundle of His. And that bundle of His basically goes towards the interventricular septum, and this particular part of the interventricular septum is the membranous part of the interventricular septum. So we would see the bundle of His inside this membranous part of the interventricular septum. And as you can see, there's a junction between the membranous part and the muscular part of the interventricular septum. And from here on, the bundle of His divides into right bundle branch that goes to the right side and goes to the right ventricle, and left bundle branch goes to the left ventricle on the left side of the interventricular septum, the muscular part of the interventricular septum. So that's where the AV node is located. Okay, so that's that. So that's about it for the right atrium. And then the blood, after entering the right atrium, it goes through the right atrioventricular orifice. Okay, so this is the orifice, and it passes on to the right ventricle. And at this orifice, we have this valve here, as you can see here. Okay, so this valve is called the tricuspid valve. Tri means three. It has basically three valves, and both each independent part is called the cusp. So we have three cusp or three leaflets. So we have the anterior, septal, and posterior. Okay, so this is the most anterior located is the anterior. The one that is closest to the septum, interventricular septum, is the septal. The one at the back, okay, is called the posterior cusp or posterior leaflet of the tricuspid valve. So these valves, basically, as you can see, it is connected with what we call as chordotendinea, or tendinous cords. Okay, and these tendinous cords basically attach to the apical part of these column-like muscles, which is referred to as the papillary muscles. Okay, these are the papillary muscles. Okay, so we're going to look at the papillary muscles a couple of minutes later. Okay, so these are the papillary muscles. Okay, let's look at the right ventricle now. Now, this is the right ventricle. So right ventricle, okay, let's look at it on this model here. So the right ventricle, okay, so this is the atrioventricular orifice. We talked about the tricuspid valve, or the three cusps, and these are the chordotendinea that attaches to the papillary muscles. This is the most anterior papillary. The papillary muscle located, which attaches to this septum, is the septal papillary. The one at the back is the posterior papillary muscle. All right. So this is the ventricle. In the right ventricle, we have a couple of sets of muscles here. And by the way, so we divide the right ventricle into two parts. Again, smooth part and trabeculated part. This part here, as you can see, the smooth part of the right ventricle. And this smooth part of the right ventricle is called infundibulum or conus arteriosus. And this part here is the trabeculated part. Okay? This part here is the trabeculated part, and this part here is the smooth part. Smooth part is called the infundibulum conus arteriosus, and this part here is the trabeculated part, also referred to as the rough part. And this rough part, as you can see, it has so the rough part, so the trabeculated part is formed by these muscles here, trabecular carnea. You can see it over here, you can see it over here, over here. So these are basically, it has this ridge column-like, okay, extensions of the inner part of the muscle wall. Okay, so these are trabecular carnea. The other muscle types are the papillary muscles. That's second. Can you see this? Okay. You have the trabecular carnea. We have the papillary muscles. That's second. And third set of muscle, we have what we call as the moderator band. Okay, so go over here. Okay, so this is the moderator band over here that connects the interventricular septum to the anterior papillary muscle. Okay, let's look at these three sets of muscles independently. Now, this trabecular carnea that has ridges and grooves, okay, these muscle is a specialized types of architecture of the inner surface that forms the inner surface of the ventricles primarily. So these basically increases the capacity of the ventricles, because what do I mean by that is that it increases surface area. When you increase the surface area in a certain tissue, basically you're increasing the amount of the things that is located there. This surface increase, primarily we see that in the small intestine by villi, microvilli. so more material can be absorbed. In case of the ventricles, more blood can be accumulated in this particular area. It also, this morphology also increases the efficiency of contraction, and it also forms the efficiency of nerve impulse conduction. So these are trabecular cornea. The next sets of muscles is the papillary muscles. This is the papillary muscles, okay? So this is the apex, this is the base of the papillary muscle. Apex is connected to the chorda tendinea, and chorda tendinea is attached to the cusps or leaflets. And this, as a whole, when you look at it, it looks like a parachute. So there's three, in the right ventricle, there's three papillary muscles: anterior, septal, and posterior. Posterior is over here. This is the anterior, septal, and posterior papillary muscle. The most developed and the most biggest papillary muscle is the anterior papillary muscle. Okay, the next muscle type is the moderator band or trabecular septum marginalis or septum marginal trabeculae, that connects the anterior papillary muscle to the interventricular septum. I'm sorry, this one here. This one here. So this moderator band or this trabecular septum marginalis is really important, and this is only located in the right ventricle. So you don't have this in the left ventricle. And the functional significance of this is that it carries branches of the conducting fibers. Okay, and primarily the right bundle branch, as it goes down, it gives off branches through this muscle, and then goes to the anterior papillary muscle. Now, the reason why you have these conducting system that passes through this is that anterior papillary muscles is far anterior, far out, okay, for the conducting fibers to be reached. And why? Because these papillary muscles should receive these impulses, these action potentials, earlier than the muscles that are located in the wall. Why? Because papillary muscles should contract first, initially, before the contraction of the ventricles itself. Why? Because when the blood gets full, when it's full in the right ventricle, it goes up and pushes these cups upwards. At that particular time, these papillary muscles contract and pulls chorda tendinea, and therefore, as these cups go up, at a certain point they stop going up because of the contraction of papillary muscle. They stop, and then you have the contraction of the ventricular wall. So therefore, these papillary muscles should receive the action potentials earlier than the other muscles that are located in the ventricles. So basically the moderator band or trabecular septum marginalis acts like a shortcut. Instead of routing around all the way through the interventricular septum into the wall and to the anterior, it makes a shortcut and then goes directly to the anterior papillary muscle. That's what. Second, it also, since if you look at the length or thickness of the muscle wall of the ventricles, so this is the thickness of the right ventricle, this is the thickness of the left ventricle. So left ventricle muscle wall thickness it's around about 3 times thicker than the right. Okay, so the right ventricles is basically thinner and more vulnerable than the left ventricle. Therefore, this moderator band or this septum marginal trabeculae basically stabilizes the architecture, stabilizes the morphology of the right ventricle, and basically it decreases the overextension of the right ventricle. It prevents the expansion of the right ventricle. Okay, so that's the second important significance of this muscle. The third is clinically in the ultrasonographic images and in the echocardiograms, when when a physician might have troubles in identifying which ventricle is which, if they see a band connecting the septum, interventricular septum, to the anterior papillary, or to any types of papillary muscle, or to the other wall, if it might appear like that. So if they see a connection of muscle from the wall, from the septum to the other to the other wall or to the other papillary muscle, they would say that this ventricle is right ventricle. So basically, moderator band in these radiological images helps identification of the right ventricle. Okay, so that's the right ventricle. So, okay, so that's right ventricle. What else do we see here? Okay, so we finished the right ventricle. Let's look at the left heart now and start with the left ventricle. Okay, so this is the left ventricle. Okay, over here. You see this auricle. You can see the auricle at the top of the atrium. So when I get this out, we see the left atrium here. Okay. Again, left atrium is formed by the smooth part and the rough part. So if you look at over here, this on this model, so this is the right atrium. And by the way, so this is the front. This is the sternocostal surface. So basically, when we examine the left atrium, we have to look at the base. So I'm turning the model on the posterior aspect, and this is where the left atrium is primarily located. Okay, so basically the base, as you can see, is primarily formed by the left atrium, and it's a quadrangular shaped, and the space is a very small amount of right atrium also goes into in this position, but primarily it's formed by the left atrium. And if I get this out, okay, you can see that again this also is formed by the smooth part, and this is the rough part. Okay, can you see this? The smooth part and the rough part. Okay, so so this is the smooth part, and this is the rough part. Now, rough part here, as you can see, is formed by the atrial appendix, or also referred to as auricle, the rough part. And this is basically formed by the primitive atrium. Now, the smooth part, as you can see here, smooth part is formed by the incorporation of the pulmonary veins. Okay, so the incorporation of pulmonary veins form the smooth part, and the rough part is formed by the primitive atrium. And again, so the auricle on the right atrium, the muscles that make up the auricle on the right atrium is the pectinate muscle, and the auricle on the left atrium again is formed by the pectinate muscles. All right, that's about it for here. And so basically, again, we have the left atrioventricular orifice that passes up, that connects the left atrium to the left ventricle. Again, we have the valves, atrioventricular valves on the left. Here we have two leaflets, two cups, anterior and posterior. There's no septal here. These are the chorda tendinea, and the chorda tendinea is attached to the apex of these papillary muscles. So the apex attached to the chorda tendinea, the base of these papillary muscles attached to the wall of the ventricle. So here we have, since we have anterior posterior cups, we have the similar name anterior posterior papillary muscles. Okay, and just look at the basically the difference between the thickness. Okay, so this is the wall of the left ventricle, and this is the wall of the right ventricle. It's 3 times thicker than the right, as you can see here. All right. And in the cross sections, when you do a cross section, so the left ventricle appears as circular, however the right ventricle appears as triangular. Okay, so so these are the cusps, chorda papillary muscles, and this is trabecular cornea, and the same thing that we see here here is the trabecular cornea. Okay, sometimes, Becky, you might see stenosis. Okay, stenosis is the narrowing of these cusps. when there's a narrowing, like you might have a tricuspid stenosis, tricuspid valve stenosis, or mitral valve stenosis. If you have a tricuspid valve stenosis, it narrows. Not enough blood would enter to the ventricles, and primarily it would stay here in the right atrium. So the blood that comes through the superior vena cava and inferior vena cava, okay, it doesn't have enough room to enter. So basically, the blood basically backs up. It backs up above to the neck and head, and it also backs up to the inferior vena cava and to the body and to the lower extremity. So when it backs up, the blood basically stays in the abdomen, and ultimately you would see ascites, what we call as ascites. And if it backs up to the lower extremity, legs and feet, it stays there. The blood basically tends to stay there because there's no place to go in. So you end up having what we call as edema. Okay. And again, if you have stenosis in the left atrioventricular valve, which is the mitral valve, it stays in the atrium. So you have the increased amount of blood over here in the left atrium. So the pulmonary veins does not have any, well, it brings blood from the lungs, but these blood doesn't have any room to stay here or to enter into the left atrium. So again, the same thing happens here too. So the blood basically backs up to the lungs, and you would have edema inside the lungs. Basically, blood tends to stay there due to overaccumulation. And basically, all the causes of this is this stenotic activity or stenotic due to stenosis of the mitral valve. Okay, so that's the left ventricle. Okay, so that's that, and let's look at this. Let's look at the skeleton. Okay. So this is the skeleton. Okay, so should I do this or this? Okay, let me do this. So you see, so this atrium is over here. Okay, and so I'm just taking this out. Okay, so it's between this skeleton of the heart is basically located between the atrium and the ventricles, and they're located around the atrioventricular orifice, right and left. And also, they're located around the pulmonary trunk and aortic valves. And this is what we see here. Well, let me... Yeah, you look at it like this. So basically, this is the right atrioventricular orifice, okay? And this is the valve here, okay? This is the valve, but this part here is the fibrous skeleton. And this is called the annulus fibrosus, or fibrous ring, okay? This is the right fibrous ring, or right atrioventricular ring. And this is the left annulus, left fibrous ring, or left atrioventricular ring, okay? So these annulus fibrosus or fibrotic ring is a tough, dense connective tissue, and basically this. So basically, the valves originate from this fibrous tissue. So basically, it forms attachment to these valves. It forms attachment for the valves, gets its strength, and originates from that particular area. Another important thing is that these fibrous ring separates the atrium from the ventricles. So basically, the action potential that is produced in the atrium, SA node and AV node, the action potentials that are distributed throughout the atrium, they cannot enter to the ventricles. Okay, so these basically act like an insulator, electrical insulator, so no electrical impulse cannot enter from the atrium to the ventricles. Why? Because in between atrium and ventricle, basically it's demarcated and limited by these rings. Okay, the only way that it penetrates or it passes through from the atrium to the ventricle is at this part here, which I will talk about it. Hold on, it's over here. Okay, I'm going to talk about that. So the second important function is forms the electrical insulator, okay? And the other important aspect of these fibrous ring is that it also acts like an origin and insertion site. Origin and insertion site for the muscles. So muscles originate and also insert to these fibrous ring. So we have basically 4 fibrous ring. We have the right fibrous ring, left fibrous ring, and then we have the fibrous trigon. This is the hold on. Yeah, this is the left trigon, and this is the right trigon. Right. Okay, so this is the left trigon, and this is the right trigon. This is the left trigon. It's a triangular shape, that's why. Left trigon. Left trigon is between left atrioventricular orifice, and then we have the aorta. Okay, so it's in between. So this area is the left trigon. This is the right trigon. This right trigon is between the right atrioventricular orifice, or right fibrous ring, along with the aorta, ascending aorta. Now, like I said earlier, in the left, okay, so this is the left trigon here. So there's an opening for the AV bundle in the left trigon, or opening for the bundle of His. So this is the only area of connection between the atrium and the ventricle in terms of nerve conduction. Okay, we don't see it here, but the opening of the AV bundle is located in the left. I'm sorry, in the right. The opening of the AV bundle is located in the right fibrous trigon. Okay, don't forget this. It might be a question. All right, in the right fibrous trigon. All right. The others fibrous connective tissue is located around the aorta, and then we have another ring, a fibrous ring, that is surrounding the pulmonary trunk. Okay, so we have 1, 2, 3, 4, 5, 6, and then we have in terms of the fibrous structure, we have the interventricular septum, the membranous part. Okay, this is the interventricular septum. This is the muscular, and this is the membranous part. So this area here is also regarded as part of the skeleton of the heart. Okay, so we have right left fibrous ring. We have the right fibrous trigon, left fibrous trigon, and then we have the ring, the aortic fibrous ring, and then we have the pulmonary fibrous ring. And last, we have the membranous part of the interventricular septum. So this is the membranous part. So basically what happens here, okay, so this is the interventricular. Hold on. So if we look at the interventricular septum, this is the membranous part, and this is the muscular part, and this is the membranous part. Now, membranous part has 2 parts, okay? So the upper part of the membranous part of the interventricular septum, if you put a needle and if it passes through the upper part, that part is called atrioventricular part. Now, atrioventricular part basically connects the right atrium to the left ventricle. Okay, and the lower part of the membranous part of the interventricular septum, if you stick a pin and if it goes through, it connects the 2 ventricles together. Okay, it's not really obvious here, but that's how it is. So the upper part connects right ventricle to the left ventricle. The lower part connects right ventricle to the left ventricle. So it has basically 2 components. The membranous portion of the interventricular septum has 2 portions. Atrioventricular portion connects the right atrium to the left ventricle. The lower part is interventricular portion, which connects the right ventricle to the left ventricle. Okay. Now at this area we have, so beginning at the right ventricle with the AV node. Now at this area we have the bundle of His. So bundle of His is basically located in the membranous part, and the bundle is at the junction of the membranous and muscular. It divides into right bundle branch and left bundle branch. Right and left bundle branches gives off protein G fibers. and I talked about the moderator band. And especially at the left part, we have the anterior fascicle and posterior fascicle. Now, the left ventricle has these, in the conductive system, there is increased amount of Purkinje meshwork or Purkinje fiber network compared to the right ventricle. So, left ventricle has conducting fibers more than the left, okay, because of its capacity, because of its functional aspect. And then, so these on the left side, they would be less vulnerable to ischemia. Why? Because the left part of the heart contains high oxygen, okay, compared to the right bundle branch. So that's that. Okay. So I looked at the skeleton. Okay, last, let's look at the blood supply, and we'll basically finish off with that. Okay, so in the blood supply, what we see here, okay, so this is the aorta. I don't know if you can see it, but okay. And and here, okay, so we have these cusps, as you can see. These are the semilunar valves of the pulmonary trunk, and these are the semilunar valves of the aorta. Okay. Now, the semilunar valves of the pulmonary trunk, we have the anterior, right, and left. Okay. Most anterior is the anterior semilunar. On the right is right. On the left is left semilunar valve. In terms of the aorta, okay, we have the right and left and posterior. This is right semilunar valve. This is left semilunar valve, and it's the posterior semilunar valve. Now, right and left is also called the coronary, right coronary valve, semilunar valve, and left coronary. The reason why they call it that is that there's an opening of the right and left coronary artery. So this is the right coronary artery, as you can see. It opens from the right. It opens from the right semilunar valve or right coronary valve, and then you have the left coronary artery opens from the left coronary valve or left semilunar valve, and the one at the posterior aspect is the posterior semilunar valve. So we have pulmonary trunk has anterior, right and left. The aorta has a posterior, right and left. Okay, so that's that. And then we have the coronary artery. We have this right coronary artery, as you can see here, and this is the okay. So this is the left coronary artery. Now, left coronary artery, as you can see, gives an important thick branch called the anterior interventricular artery, which is this. It is also referred to as LAD, left anterior descending. Along with that, we have the great cardiac vein runs along with it. And the other branch is a circumflex. So this branch here, we're just going to call the circumflex, and we can call this as left marginal. Okay, so this is the this one here is the circumflex. So left coronary, these are the major branches. Okay, so we can, we can only, I'm just concentrating on the major branches. So left coronary gives off LAD, anterior interventricular artery or LAD, and the circumflex. The right coronary artery, as you can see here, right coronary artery. Okay, right coronary artery, it gives off this marginal, right marginal branch. At the back, it gives off. Okay, let's look it over here. Okay, so this is the right coronary artery. It gives off this marginal branch. Okay, right coronary, just beneath the right auricle. If you get the right auricle out of the way, okay, this is the marginal branch. Okay. Okay, so this is the marginal branch here, and the one that goes to the back, to the diaphragmatic surface, is the posterior interventricular artery. Okay, posterior interventricular artery, or PDA, posterior descending artery. So posterior descending artery runs with the middle cardiac vein, vena cardiaca media. At the front, we have the anterior interventricular artery runs with the great cardiac vein. Okay. Again, at the back over here, we have the small cardiac. So small cardiac and middle cardiac, we see these two together at the back, at the diaphragmatic surface. At the diaphragmatic surface, small cardiac, middle vena cardiaca media and vena cardiaca parva. And these two guys open, so as you can see, a big vein, which is called the coronary sinus, or sinus coronarius. Sinus coronarius is a big vein, and it's located in the coronary sulcus, between the ventricles and the atrium, especially the diaphragmatic surface of the heart and the base of the heart. So there's a groove here, a coronary groove or sulcus, and you have this big vein here, which is coronary sinus, and coronary sinus is ultimately open to the right atrium. So at the front, so this is the great cardiac vein, vena cardiaca magna, okay, goes up and joins the coronary sinus. Where does it join? It may join over here or over here, okay? So basically it continues or drains into the coronary sinus. So this is probably the continuation of great cardiac vein. And starting from maybe here to here is the coronary sinus, because coronary sinus is the remnant of the left horn of the sinus venosus. So left horn is at the back here, so left horn changes or develops into the coronary sinus. So at the front part, you don't see coronary sinus. So this is probably the continuation of the great cardiac vein, or vena cardiaca magna. Okay. And this might be the left marginal vein and left marginal artery. Okay, so that's the arterial distribution. That's the arterial distribution. Okay. Okay, one thing I didn't mention and I didn't show you, hold on, is this guy here. I don't know if you can see it. Can you see this white area here? That's ligamentum arteriosum, this white area. So this white area basically connects the arch, the aortic arch, to the left pulmonary artery. Okay. So this is the pulmonary trunk, left pulmonary artery, and left pulmonary artery is the right pulmonary artery. As you can see, this white ligament connects the arch primarily to the left pulmonary artery. Now ligament, so initially this was ductus arteriosus. So ductus arteriosus, the reason why we have that is that as the blood goes through the right ventricle to the pulmonary trunk, okay, from the pulmonary arteries it should go to the lungs, but in the embryo, since the lungs are not working, there's no respiration going on, so you don't want blood to go there, okay? So it bypasses the pulmonary arteries, it goes through the ductus arteriosus to the arch and to the aorta and to the system. But later on, after birth, lung starts to work, so then the blood basically goes to the pulmonary arteries, to the lungs, and due to the increased amount of oxygen concentration, this duct, okay, becomes ligamentous, and it becomes a ligament, and we call this ligament as ligamentum arteriosum. But initially it was ductus arteriosus. Okay. Hi everybody. Now let's look at the heart inside the cadavera, inside the thorax of the cadavera. So if we come over here, so first we have the skin, and if we dissect the skin out, okay, so we have the superficial fascia composed of the fatty tissue, And if we reflect these on both sides, what we see is the pectoral muscles. We have the pectoralis major on the left, and then we have the pectoralis minor again, just beneath the pectoralis major, and then we have the pectoralis major and minor on the right side. So this is the thoracic cage, which is again composed of the sternum and the costa, the bony part, and the cartilaginous part at the front. And these are the intercostal muscles. Okay, and this is the jugular notch, and here is the sternal angle, or angle of Lewis. And this is the clavicle here. Just beneath that is the first rib. Just beneath the clavicle is the first rib. So this is the second rib. At the level of the second rib, on either side, and there's a bump here. And this bump is the is called the angle of Lewis, or sternal angle. And and it basically demarcates the level of the second costal cartilage, by the way. So remember we talked about the auscultation sites. So this is the first, second. So beneath the second costal we have the intercostal space here. The second, on the right, the aortic valve sound is heard via the stethoscope on the right, and on the left side we have the second intercostal space. On the left side, the pulmonary valve is heard, and going down the second, third, and fourth intercostal space is where the tricuspid valve, 4, and then 5. The fifth intercostal space, again on the left side, is the mitral valve, and then again around about like 8 to 10 centimeters from the midline of the sternum, and the vertical line that corresponds to the mid-clavicular area, which is the mid-clavicular line. So around about here would be the sound of the mitral valve. Okay, so these are the normal auscultation sites of the sounds of the valves. All right. So if we reflect this, get the anterior chest wall out of the way, what we see here is basically the thoracic cavity. In the thoracic cavity, or thorax, we see the major organs, like on either side we see the right lung, left lung. Okay, and in the thoracic cavity, in the midline, is basically referred to as the mediastinum. Okay, so we have the anterior mediastinum located between the ribs and the pericardium. This is the part of the pericardium here. So between the ribs and the pericardium is the anterior mediastinum. Okay, and there's structures that are located here, and this is a different topic, of course. We have the anterior mediastinum. Middle mediastinum is where the heart is located, and if we get the heart out of the way, and then we have the posterior mediastinum. So the area where you see the heart is so the heart is basically placed in the middle mediastinum, or middle mediastinum is part of the inferior mediastinum. So inferior mediastinum divides into anterior, middle, and posterior, and the heart is located in the middle mediastinum. And if you look at the design and the organization of the thoracic cavity or the mediastinum, you would see that the heart, especially this part of the heart, the surface, is a diaphragmatic surface. The reason why, as you can figure out yourself, the diaphragmatic surface sits on the diaphragm. So this here is totally the diaphragm, and this whitish area here is the central tendon of the diaphragm. So we have the hemidiaphragm, right hemidiaphragm, left hemidiaphragm, and it is purely muscular. However, in the center, it's purely tendon where the muscles attach to. Therefore, the diaphragmatic surface is attached to the tendon of the central tendon of the diaphragm via ligaments, and it basically sits on the tendon of the diaphragm, or central tendon of the diaphragm. Okay, the other thing is that these attachment points, we have certain ligaments, okay, that is also involved in stabilization of the heart in this particular middle mediastinal area. We have sternopericardial ligaments. So on the inner aspect, of course. So it attaches from the inner aspect of the sternum to the pericardium, sternopericardial ligaments. we have phreno-pericardial ligaments that attaches the diaphragmatic surface to the central tendon of diaphragm. In sterno-pericardial, we have superior inferior, so one at the top and one at the bottom. And then we have the vertebral at the posterior aspect. We have the vertebro-pericardial ligament that attaches the posterior aspect of the heart to the vertebra. These ligaments basically stabilizes the heart in that particular place. And this stabilization is also accomplished by the pericardium superiorly too. So we have anterior stabilization by the sternopericardial ligaments, superior and inferior, inferior stabilization by the phreno-pericardial ligaments onto the central tendon of the diaphragm, and then we have on the posterior aspect we have the vertebral pericardial ligaments. Superiorly, this stabilization occurs via this pericardium. It basically diffuses and blends with the tunica adventitia of these great blood vessels. Okay, so there's two continuation of the heart with the vessels. One via tunica adventitia with the fibrous part of the pericardium. Fibrous pericardium basically blends and diffuses with and continues with tunica adventitia of the great vessels like the pulmonary trunk and the ascending aorta. And then we also have a blending and continuation of the tunica endocardium, which lines the inner surface of the heart, that continues with the tunica intima of the blood vessels. So we have two continuations. Clinically, this is important because at some point far away, if there's an infection or disease, okay, or bacteria-related or viral-related infection or diseases, so these infections might spread through the tunica adventitia and tunica intima. Through the tunica adventitia, it might come all the way to the heart. From here, from the heart, it will penetrate to the pericardium and may cause what we call as pericardial effusion. Okay, and this pericardial effusion basically accumulation of blood, either blood or fluid, in the pericardial cavity, and that will compress. This fluid accumulation would compress the pericardium on the heart, and basically allowing the heart to, it basically decreases the amount of contraction and decreases the amount of workload of the heart itself, and less amount of blood is basically pumped out due to this compression. This compression of fluid in the pericardial cavity on the heart is called pericardial tamponade. In terms of tunica intima infection, if it goes down, it would basically cause an infection of spread of infection in the endocardium, causing endocarditis. So the infection in the pericardium called pericarditis, and the infection of the endocardium is called the endocarditis. And these infections, like I said, might originate from the vessels via tunica adventitia from the outside, or from tunica intima from the inside, going into the endocardium, or going into the pericardium, causing pericarditis. And pericarditis might cause pericardial effusion, and this pericardial effusion, accumulation of fluid, may cause a cardiac tamponade, compressing on the heart walls. Okay, so this is how it looks like in the cadaver. So now let's go, and I'm going to show you the heart individually now. Okay. Okay. Hi. When we take the heart out from the thoracic cavity, let's look at the heart independently on the cadaveric heart. So what we see here on the outside is the pericardium, just like I showed you previously in the cadaver. So this is the pericardium. As you can see, it covers all the way to the roots of the great vessel. So this is a great vessel. So you have the pulmonary trunk here. We have the ascending aorta, and we have the arch of the aorta. As you can see, the pericardium covers the initial part, the roots of the great vessels too, and also it blends, like I said earlier, it blends with the tunica adventitia. Okay, so this is the pericardium. Okay, let's look at the pericardium. So pericardium is basically a pericardial sac. Basically, it covers the heart, and it's composed of two layers: fibrous pericardium and serous pericardium. Now, the outer layer here is the fibrous pericardium. Is really tough, composed of collagen fibers. Okay, it's and the fibrous pericardium primarily is involved in stabilization of the heart and putting the heart in that particular position, and also it prevents the overload or over expansion of the heart. It restricts its basically the volume of the heart, and also. So that's the fibrous pericardium. But overall, in pericardium, I'm going to talk about the two layers of pericardial cavity, and inside the pericardium there's pericardial fluid. So overall, the pericardium is involved in lubrication. So when the contraction occurs, so the outer wall of the heart is not basically in contact with the surrounding structures, and therefore reducing the amount of friction. And the last thing of the pericardium, it also it basically is, since it covers all the heart itself, it also prevents the infections to basically going through the pericardium. However, like I said, since the pericardium blends with the tunica adventitia, the infection may spread through this layer to the pericardium. And we talked about the pericardial effusion and pericardial tamponade. So like I said, there's two layers. Fibrous pericardium is on the outside, and then we have serous pericardium is on the inside. This shiny part that we see here is the parietal layer of the serous pericardium. Now, parietal layer attaches firmly with the fibrous layer. Okay, so that's what we see here, but it's difficult to detach because they're firmly attached to the fibrous pericardium. So when you lift the fibrous pericardium, the parietal layer of serous pericardium basically comes with it. So this shiny part is the parietal layer of serous pericardium. Now, the visceral layer of serous pericardium is somewhat these guys here. It's really thin, and the visceral layer is the one that covers the heart. The visceral layer of serous pericardium is also called the epicardium, and these two layers, in between these two, there's a gap, there's a space, and this space is called the pericardial cavity, where the serous fluid basically travels in. Okay, so we have the visceral layer of serous pericardium, parietal layer of serous pericardium, parietal layer of serous pericardium, the visceral layer of serous pericardium. In between these two, we have the pericardial cavity. And inside the pericardial cavity, we have the pericardial fluid. Now, two sinuses that I talked about earlier, the transverse pericardial sinus and oblique sinus. Now, if you cut the pericardium from the outside, you will get inside the pericardial cavity. So when you go in the pericardial cavity, and when you stick your finger on one side, you will end up having your finger out on the other side. So what happens is that, so this, where I'm sticking my finger in, I'm inside the pericardial cavity, okay, and this is basically a hollow space inside the cavity, and clinically this is important, and this is called the transverse pericardial sinus. Transverse pericardial sinus, where is it located primarily? It's behind this guy here, which is the pulmonary trunk. It's behind this guy here, is the ascending aorta, and it's in front of this guy. It's in front of this guy here, and this guy is the supravena cava. So it's in between pulmonary trunk, ascending aorta, and supravena cava. So what they do is, clinically, why is it important? Is important in that in going through this canal, whatever you want to say it, they can clamp. Okay, they can clamp this. They can clamp the outflow, or they might clamp the inflow. Okay, so during coronary bypass surgeries, they do these techniques, and they use this transverse pericardial sinus in order to uh, accomplish these techniques. Okay, so that's transverse pericardial sinus. How about the oblique sinus? Oblique sinus is located at the back. Okay, as you can see here, this is diaphragmatic surface. So oblique surface is going through the down from the apex backwards to the diaphragmatic surface. So I'm turning around. So this is diaphragmatic surface going up. You see this cul-de-sac. It's a blind end here. So this is the pulmonary veins. Okay, pulmonary veins, and then you have the inferior vena cava somewhere around here. Yeah. So these are the pulmonary veins, and this is the inferior vena cava. So you go in this direction, and you hit a blind end here, and then there's a hollow space here. So we're talking about, again, the empty space inside the oblique pericardial. This is oblique pericardial sinus. It's a J-shaped, okay, a J-shape. So it basically, the outlines of this oblique pericardial sinus is the pulmonary veins and the inferior vena cava. This is the inferior vena cava, and these are the pulmonary veins. And this is the oblique pericardial sinus. Okay, so that's pericardial. This is, by the way, the superior vena cava here. This is the right brachiocephalic, all right? And this is the left brachiocephalic vein. Okay, so you see, so it should be like this. So the right brachiocephalic is kind of vertical. However, the left brachiocephalic is obliquely directed. These two brachiocephalics unite and they form superior vena cava. The superior vena cava, and here is the inferior vena cava. Here is the inferior vena cava. Now, there is a branch that connects with the superior vena cava. This is the arch of azygos. This big guy here, it connects with the superior vena cava. That's the arch of azygos, and arch of azygos is basically a continuation of the azygos vein. Okay, let's look at the major blood vessels here. This is the ascending aorta. At the beginning of the ascending aorta, we can see the coming off from the initial part of the ascending aorta is the right coronary artery. You see, it's the right coronary artery. Okay, right coronary artery gives off the marginal and right coronary artery gives off the marginal and the circumflex. I'm sorry, right coronary artery gives off the marginal. Right coronary artery gives off the marginal and the posterior interventricular artery. So anyhow, so this is the right coronary artery. What else do we have here? We have the pulmonary trunk here, and it divides into right and left pulmonary arteries. And this guy here, you see, it connects, this one here. It's connecting the left pulmonary artery with the arch of aorta, and this is the ligament. This is the ligamentum arteriosum, which is the remnant of the ductus arteriosus. Okay, we talked about that. Okay, let's look at now to the right atrium. Let's look at the right atrium now. You see the right atrium again, as I told you earlier. During the explanation of the models, we have the trabecular cardia, the rough part of the right atrium. This is pectinate muscles, okay. And we have the, okay, so here is the smooth part, sinus venarum cavarum, the smooth part, which forms the interatrial septum. And at that particular area, I don't know if you can see it, this oval-shaped area here, this is fossa ovalis, okay? And around that the elevation of tissue, that's the limbus fossa ovalis, which is surrounding the fossa, okay? the area where coronary sinus enters the right atrium. Let's look at that. One thing I forgot to explain to you. Okay. So this is the area. Somewhere around here. I don't know if you can see it, but somewhere around here is the ostium of coronary sinus. So this is the coronary sinus, sinus coronaris. When you follow that, so it opens somewhere around here. This is the open of the coronary sinus. Okay, and some of these veins here, you see these openings here, small openings. These are openings of the small veins, or what we call as the Sebacean veins. It's really small veins. They can open to either chambers, but primarily they open to the right heart, either right atrium, right ventricle. But they can also open to the left part. Although it's a clean blood, these are really small veins, so it doesn't really matter. But they primarily open to the right side of the heart, the Sebacean veins, and they have separate openings. Okay. And we have the the atrioventricular or the atrioventricular ostium. Okay, and then we have in the atrioventricular ostium we have three cusps, anterior, posterior, and septal, that opens to the right ventricle. Okay, so this is the anterior cusp or leaflet. This is the septal, and then we have the posterior. The anterior connects with the anterior papillary muscle, okay, and then we have the septal attached to the septal muscle, and then we have one on the posterior side. We have the posterior cusp that attached to the posterior papillary muscle. Now, interesting thing that we can see here. Okay, like I said, one of the important muscles in the right ventricle is the moderator band or trabecular septum marginalis, which is this connecting the muscular part of the atrioventricular septum to the anterior papillary muscle. So these are the questions that we really like and to ask you guys in your exam. These trabecular septum marginalis, and these are trabecular cornea, and this is the apex, of course. That's it for right ventricle. Let's look at the left ventricle. Left ventricle, again, trabecular cornea. These ridges and grooves, okay, column-like structures. And if you look at the thickness of the left ventricle, you see how thick, 3 times more than the right ventricle. You see, and then again we have the mitral valve here. Mitral valve. Okay, we can't really see it, but we have the anterior and posterior papillary muscles. These are papillary muscles. These are trabecular corneas, chorda tendinea, and the cusps. And basically, these resemble like a parachute. Don't forget. So these atrioventricular valvular complex include the leaflets, chorda tendinea, and papillary muscles, and the ostium make up the complex, and it resembles a parachute. Now, one thing it's not really apparent here, but this guy here, this is a supraventricular crest. Now, supraventricular crest. Let me show you this in a model here. So this is a supraventricular crest that divides the inflow from the outflow in the right ventricle here. Okay, so this is a supraventricular crest. It divides the inflow from outflow. Outflow is the pulmonary trunk. Inflow is, of course, is the ventricle, the supraventricular crest. Now, in the left ventricle, and by the way, in the right ventricle, the smooth part, like I said, is the infundibulum of conus arteriosus, and we have the rough part, and this infundibulum conus arteriosus is derived from bulbus cordis. The rough part, the trabecular cornea area, is derived from the primitive ventricle. So this is what Christus supraventricularis or supraventricular crest that divides into. However, in the left ventricle, we have aortic vestibule. Aortic vestibule is a smooth part, okay? And then we have the rough part. Aortic vestibule is derived from the bulbus cordis, and the trabecular part is derived from the primitive ventricle. And there's no Christus supraventricularis, so supraventricular crest on the left side. However, so what divides from the inflow and outflow? So the anterior cusp or anterior leaflet of the mitral valve basically divides the inflow and outflow on the left side. So that's left ventricle, I talked about that. Left atrium's at the back, as you can see. So this is the left atrium. Again, mostly smooth part, and two pulmonary veins, right and left, two of them. And then we have the mitral valves in it. No special features on that. And if we look at the blood vessels quickly, so this is the left coronary artery, and the major branch here is the anterior interventricular artery, which is this, along with the great cardiac vein. Okay, and this is also referred to as LAD, left anterior descending, the great cardiac vein or vena cardiaca magna. The other branch of the left coronary is the circumflex. Okay, so this artery here is the circumflex artery. Okay, primarily it goes all the way to the back here. Continuation of the circumflex. This is left marginal, by the way. Okay, so that's left coronary. If we go and look at the right coronary artery, this is the right coronary artery coming from the right coronary ostium of the right side of the sinus, and this is right coronary. It gives off right marginal, and the major branch of the right coronary is the posterior interventricular artery. So this is the posterior interventricular artery, along with the middle cardiac vein or vena cardiaca media, and along with the great cardiac vein, I don't see, but there's also the small cardiac vein. You have small cardiac vein. I don't see it here. It's been broken. And then we have the middle cardiac vein, and these two drain into this guy here, this big mama here, and this is the coronary sinus or sinus coronaris. It drains into the right atrium. Okay, so that's that. I think I don't know. Maybe if I left anything over, we'll go into the house. Last thing that I really want to show you last is, I don't know if you can see it inside. So this is the ascending aorta, and if you look at it in deep, you would see the semilunar valves. Three of them, a cup-like shaped, okay, semilunar valves, and I don't know if you can see it over here. Oh, okay, let's go over here. So this is the pulmonary trunk. Look, when I open this, you see these leaflets? You see, these are the semilunar valves of the pulmonary trachea. What do we have? We have anterior, right, and left. You see these valves are cup-like, okay? And the free edge is basically what we call as lunule, and the center, it's kind of dense build-up tissue in the center, and that area is called the nodule. So the whole surrounding of the upper edge of this semilunar valve is lunule. The center has increased massive tissue, and that is called the nodule. Okay. So with the systole, they close. With the diastole, they basically get filled with blood tissue. Okay. 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 So thank you very much for listening. I mean, that's about it. So I went over the models of the heart, and then in detail, of course. Okay, this is the end of our video, and hope you enjoyed it. We went through a lot of stuff in the models, the heart models, and the cadaver, or wet specimen of the heart, and hope you enjoyed it, and good luck in your exam. Okay, bye bye.